If we do it right, and then technology will actually have for teachers, we have actually some of the benefits, because it may reduce actually on the amount of work that they have to do at home. So now the question remains on our side: how do we make sure that we build platforms that are easy to use and that are also adaptable to the devices they have.
In the case of infectious disease, so mathematical models in general can project how infectious disease progress, show the outcome of an epidemic, and help inform public health for intervention. And mathematical models can take many forms, so they can be dynamical models, statistical models, differential equations, and even sometimes strategic.
How do we model our own diseases, TB, HIV in Africa? Of course, I know we get money from UNAIDS, we get money from WHO, we get money from CDC, but I believe it's high time now we dictate our own course.
When it comes to vulnerable groups, I think solidarity, be it national or international, is quite critical. Looking at the example of Rwanda, community-based groups like the cooperative movement in Rwanda, I think we don't say it enough, but the cooperative movement in Rwanda has been probably one of the most important solutions for fighting poverty. You have these women coming together in cooperatives in rural areas, in urban centers, and as Dr. Isaac was saying, many people work in the informal sector and they rely on daily jobs to put food on their tables. So these people coming together, I think, is the best way to get services channeled to them. It can be government, it can be NGOs, it can be even private sector organizations. I think even for us as a bank, it's safer for us to provide access to finance to a cooperative that is well organized than doing small loans to the individual farmer or trader.
We need to have partnership frameworks that are more strategic, that are more holistic, and that are more anticipatory in their capacity to understand that COVID is a pandemic, but it's only one of several types of global shocks that could have effect on African economies. And the most interesting of them, in fact, I'd say in some ways, COVID is a blessing in disguise because it had the merit of revealing for Africa the enormous dependency that some countries in particular have on food imports. Food sovereignty should be a precursor to food security.
Big data being used, being these huge sets of data, depending on if it's personal data, mobility data, weather data, health data, all this data, is how do you use this data in a different context? Data being the knowledge that you have. How do you either create new forms of data, utilize this data in a different manner? And utilizing data in a different manner can mean combining different data sets to get new forms of insights. China noticed this, and then Europe has seen something totally different. And these are all different data sets that were being produced. And what do you do in Kenya when you're hearing this? You start collecting this data and trying to understand how can I complement our health system to be able to see if this pattern is seen somewhere else.